So my name's Chris Turner. I'm the Executive Director of Connect. So Connect is an organisation that is on the planet to disciple nations, and our mission really is to equip, release and activate people into missions, and in so doing that, working in different spheres of society, whether it be education, government, communications, the arts. And we're really focused on laying a foundation so that people have healthy family, healthy community, and from that foundation can be like proactively activated into those different spheres and be effective in what they do. So this was in February 2016, and they were staying at, we live in a campus here. Our main office and headquarters is based at this campus. And the lady of the couple of the boy that had hit his head, she came to our house in floods of tears, and she said, yesterday our son Malachi, he banged his head, he rolled off the bed and cracked his head. And we'd heard about it, but we said, like these things happen. Our children have fallen off beds many times before. I'm sure it'll be okay. But this next day she came and she was really distressed. She's like, no, he's acting strange. There's something wrong. And she was really upset. And so my wife, who's actually a nurse, she went with her back to the house and started, looking at the child. And then he started throwing up. So like there was something wrong. Clearly there was something going on. And my wife said, yeah, there is something going on. You need to go to the hospital. I think they ended up going to 2 hospitals before they got to the right hospital where they could get the right doctor to see. And then it was fairly evident, yeah, there's a problem. And they had to insert a shunt into the child's brain to drain the fluid off the stem so that there wasn't pressure built up in the brain, causing the discomfort and the sickness that the child was having. And it was a life-threatening situation. This wasn't just a bang on the head. This was like, no, there's a significant bleed on the brain stem. And so they went that process. They went to total shock. I don't think the parents had even realised what situation they were in, because it was several hours later when they suddenly, it dawned on them, oh my goodness, we forgot to put Malachi on our insurance policy. And I understand that, because we've had children, and I think there's a grace period with Talent Trust of 30 or 60 days before you actually have to formally put them on. Which is great. I mean, even that's an amazing thing in and of itself. But they'd gone way past that by a good couple of months. And so all of a sudden it dawned on them in this process, oh my, we may not have insurance for this. So one of my colleagues that deals with these particular situations started getting into it, and it was clear, yeah, that this child is not insured. And so the expectation was, at that point, there was not only the stress of really a life-threatening situation for a 4-month-old baby for this parents, but there was also the additional stress of, this could mean that we're, the reality is in what we do. This, we're not in a profession that, puts money in the bank. We're in a profession that drains money from the bank, and then when that's all gone, we live on what's left over and the goodwill of our fellow man. So $30,000, even as this could be the claim kind of statement, is far beyond our initial faith capacity. And so it just becomes another layer of panic and another layer of stress, and it did for the family. And the lady, the wife, she went to total tailspin, and I believe that the guy did too, the husband did as well, but he was masking it much more. So at this point, the family weren't sure where this was going to go. So the decision went off to Talent Trust, and the family were understandably very stressed. And it wasn't very long before there was a response back. It was very timely. So the decision came back, and Talent Trust said, yes, we will cover the cost of this claim, even though by the policy agreement we don't have to. But they swallowed the cost, and they made that choice. And that was huge for the family. The sense of relief was palpable, and just that weight was gone, even though there was tremendous weight still on them because it was actually a long time in intensive care. But you could tell just not having that level of stress on them was just massive for them. This whole process of walking through this particular situation with Talent Trust has just been massive, because it reinforces we know that we can trust them as an insurance provider, and not only trust them, but they've got a relationship with us. And seeing how they responded specifically in this situation, Talent Trust have just been outstanding in their provision and support to us as a community. And again, we're really thankful for that. And the key for that, I think, honestly, is in the level of relationship. That's where the trust is built, in that relationship. And so they're able to they know our members, they know our people, they've bothered to pay that price. And that just makes a huge difference to these types of processes, because they're engaging the people that they know. We're not just names on a piece of paper. or money in the bank. We're actually families and people with kids and lives. And so in light of the story that we've shared today and the stories that we have in our community over the years in our relationship with Talent Trust, I would honestly say thank you for an outstanding service. Thank you for showing up when it's really counted. Thank you for paying a price for us in different ways when you haven't necessarily needed to, but you've made that decision, you've made that choice based on the relationship that you have with us. You've provided an outstanding service over these years, and we're truly deeply thankful. And thank you for actually entering a niche in the missions community that's absolutely necessary and needed. And I just want to say thank you and keep going for it, keep developing and growing. It's a massive blessing to all of us.